This is fun. I almost had to call my husband in to help me out. Okay, well, hello, colleagues and friends. Welcome to the Unconventional Hygienist. Round two, where we are going to be discussing changing the face of dentistry, and medicine, and advancing practices of dental hygienists, dentists, and uh, hopefully body workers. The goal is of the unconventional hygienist mainly is to get the information out there. I wanted to start this a long time ago, but nothing was ever perfect. Nothing was ever ready. And in order for me to launch, just like with today, at that point in time, it would have driven me nuts and then I would have canned it. So, um, but that's what we're about. We're just going to do this unconventionally. It is going to be recorded, and then I'm going to put it on YouTube on my YouTube channel, The Unconventional Hygienist. I am going to also hopefully be able to get it onto Buzzsprout, and so we can start to launch this podcast. So thank you for bearing with me. Let me scroll down here so I can see your comments in live. Perfect. Okay. So my goal of the unconventional hygienist, like I was saying, was to get the information out there. We're going to talk today just briefly about my business, Alamedin, and why I changed the name. And then we're also going to talk about the Institute of Orofacial Recovery. So, without further ado, the first thing I want to talk about is the business, Alamedin. So originally, I've had three different names, and why am I all over the place? It seems with these names, and it's because I wanted to find something. Originally, we were Myo Northwest. So, for anybody who doesn't know me, let me give you a little bit of a background. I have been in dentistry since 2009. I started out as a dental assistant, and then I went to dental hygiene school in 2013, graduated in 2015, and I'm going to be honest, I got bored. And I knew that I would. Even before I got into hygiene school, I knew that it was always a stepping stone to something bigger, to something different. And I'm not saying I'm not minimalizing hygiene. Absolutely not. Was very good at what I did. I'm very good at what I do as a dental hygienist. I love my patients. I love patient care. I love enjoying that one-on-one time with my patients. However, it is very repetitive. As we know as hygienists, it's very repetitive. And there's got to be more to it. And I knew that there was more, there's always more to something. Ever since I was a little kid, I would break things apart just to see how they worked, always asking the questions why. And so when I got into dental hygiene school, I knew that wasn't going to be the end. That was a part of me that the road that I needed to travel down in order to be basically where I'm at today. Did I know where I was going to be? Absolutely not. Um, absolutely not. And so even this time last year, I didn't know that I was going to be on the road that I am today. So, and we're going to get into that just a little bit. So we started out, I started out in various offices, and I was working for amazing dentists and some, older dentists, they are set in their ways, and that's okay. It works. It's bread and butter practices that, you make revenue, you pay the bills and you're happy and there's nothing wrong with that. But it wasn't for me. I was the hygienist that I would plop down case studies and research and all these things on my boss's desk. Let's do this. Let's do this. Let's grow. And we didn't get anywhere. So I ended up working in a sleep dental practice. And then that's when I found why. That's when I found my why. Why do we have sleep apnea? Why do babies have sleep apnea? Children, adults, TMJ, what is happening? What's going on? And that kind of started my rabbit hole into figuring out who I was and the type of person, professional that I was going to turn out to be. Um, so being in a sleep practice opened up my eyes into orofacial myofunctional therapy. Orofacial myofunctional therapy, if you don't know, it is exercise-based therapy for the muscles of the tongue, muscles of the face to help with sleep apnea and growth guidance. A lot of myofunctional therapy originally is built up from the growth guidance, making sure that the tongue is in the proper position to sit at the roof of the mouth so the jaws grow in properly. It helps retain the teeth. Muscle moves bone. And if the tongue isn't sitting at the roof of the mouth, if it's sitting at the floor of the mouth, more than likely it's also sitting at the back of the throat. And then it becomes low tone because it's not functioning the way that it should. And if it's low tone, it's falling to the back of the throat. And that's how it's correlated with sleep apnea, obstructive sleep apnea. And of course, if the jaws are undeveloped, as my myofunctional therapists here, we know if the jaws are underdeveloped, what's connected to the jaws is the airway. So you've got obstructive sleep apnea. There's also centralized sleep apnea, which is neurological, and we won't really get into that. But that's the gist of orofacial myofunctional therapy. So I was originally in classes for that to help support the provider that I was working for. And I wanted to implement in the practice, but I wasn't able to implement it the way that I wanted to in the practice. I wanted creative control, and I felt that I was working my behind off for for somebody else's business. And it's not a bad thing. And there are hygienists and providers that are happy doing that. I just wanted more. There was so much more to it. But in that process, I learned about my own dysfunctions. And and so it was for cosmetic reasons. I mean, I didn't like the way my teeth were situated anyway. I started going into Invisalign. Invisalign, it was very painful for me, very, very painful. I was non-compliant. I am not the compliant hygienist. I'm not the compliant patient. I can't even take my medications on time or my vitamins on time. So, I decided that I was gonna go into traditional orthodontics, and so when I went to see the orthodontist and I got 3 different opinions, every single one of them told me that I needed orthodontic surgery. For anybody who doesn't know what orthodontic surgery is, it's jaw surgery. We pull the jaws forward or to kind of or resituate the jaws so the teeth fit properly in the face, right? And so we can chew and function and eat and breathe and all these things. And there's 3 different types of surgeries, and we'll get into that way, way, way down the road. But so anyway, uh so I was like, okay, I let's pull the plug. Let's go ahead and do it. So orthodontics. Then I had orthodontic surgery in 2019. I at the end after my surgery, I was swollen for a very long time, and I started questioning why. Why am I swollen? And I started to do my exercises again, and I couldn't do them. I couldn't do the exercises that I had mastered before going into orthodontic surgery. Why? So, my muscles had atrophied. Wasn't using them the way that because I had a palatal splint that went straight across. I couldn't swallow, I couldn't chew, I couldn't eat. I had lockjaw for a very long time. I was very frustrated. Um, I just wanted to go back to normal as efficiently and as quickly as possible. And so why? Why is it? And so then I started doing the research about pre-surgical and post-operative care. And this is only a very small portion of why I went to massage therapy school. But why is it that we do pre-surgical and post-operative care for every single part of the body except for the face? Why? Why aren't we, um, we advocating for that? And so I looked at myofunctional therapy not just in growth guidance and airway, but in as from a rehabilitative state, from a recovery state. And to this day, surgery was in 2019. To this day, I'm still numb. My chin is still numb. And as hygienists, we know that we have patients in our chair that are numb for 20, 30 years, if not longer, for the rest of their life from these surgeries. So my um doing the research, and there's just nobody. You can go see your face yoga specialist. I've had my occupational therapy. Even, I went to massage therapy school because I originally wanted to get into craniosacral therapy. And the only way that I could have done that in Washington State. So there's a lot of different pieces that are my drive into massage therapy school. I wanted to originally do craniosacral therapy. And in Washington State, as a dental hygienist, we don't have a license that allows us to perform that um, scope of practice because it's a practice. There's something in our licensure being a licensed dental hygienist. We can't work without being under the supervision of a dentist. Now, can we do craniosacral therapy in the dental practice? That's the question. I don't know. I think it's a very gray area because we're working underneath the scope of practice of a doctor, of a dental provider, but it's regulated by the Board of Massage here in Washington State. And so that's the regulatory body. And plus we're working on the rest of the body. When in dentistry, we only focused on the face. So craniosacral therapy, it really it goes from the cranium to the sacrum. So that's where we can't, that's where it crosses the line. So anyway, I decided to go to massage therapy school after lots of research and talking to other people about how I could advance what I'm doing and apply it to my functional therapy practice. I closed down Myo Northwest in 2019, right before orthognathic surgery. We moved from a little island out in Oak Harbor down here um, to Marysville, just north of Seattle, about an hour north of Seattle. And I started piecing the puzzles together, the missing pieces where we're at with myofunctional therapy. I went to school for lymphatic drainage. They allowed me by credential because I'm a dental hygienist to take their head and neck lymphedema course without having to take the entire body course. And I want to side note there for a little bit is that it's so frustrating that as a dental hygienist, as a nurse, I could go and do cranial psychotherapy. I can do intraoral massage. I could do all of these things, but as a dental hygienist, I cannot. But we have the same prereqs that nurses do. So, anyway, my biggest frustration with the educational system is that why can't I just go to school to be a specialist? Why do I have to go to the full body massage therapy school when I just want to focus on the face? Why do I need to go to spend $4,000 to take a lymphedema course for the rest of the body when I just want to focus on the face? And talking to my lymphedema therapists, these courses, it's like maybe 5 minutes that they talk to you about the face. The face is ignored in almost everything. And so this is where I focus. My passions is on the oral facial complex and combining the tongue therapy in that. Now I get a lot of questions. Well, it's physical therapy. Well, not really, because physical therapists aren't trained on the tongue either. The tongue training is not in anybody's scope of practice. It's not trained in schools anywhere. So that's why we have the Association of Myofunctional Therapy, the IAOM, the AOMT. That's why we have all these different educating bodies that just focus in on the tongue, because even in hygiene school, we weren't really trained on the tongue. We were trained on what the tongue does, but not and barely touched on anatomy and physiology, but where's the kinesiology of the tongue and how it functions? So I'm working with Visible Body. They are going to develop a program um, to break down the muscles of the tongue. So I'm hoping that will be launched in the next year or two. So it's so important to, as a hygienist, to learn these things as a medical provider, to learn these things, even as a massage therapist, to know the muscles of the tongue and how it affects the TMJ. I get referrals from physical therapists all the time because they go intraoral, but they don't work with the muscles of the tongue. And so that being said, even physical therapists work with TMJ, but they don't work with the muscles of the face, smiling, muscles of facial expression. So when we talk about, long story long, Alamedin, we went from Myo Northwest. I closed down that business, and then we were About Face. So the goal of About Face, I was in the military. I spent 8 years in the military, 6 years active, 2 years inactive. Um, when we talk About Face means a turnaround, but I was also working on the face. And when I relaunched the practice last May in downtown Seattle, um, I was going to just do myofunctional therapy, craniosacral therapy, but I started getting an influx of patients who have had oral cancer and facial reconstructive surgeries, and they were finding me. And so we kind of shifted gears. And shifting those gears made me think that there's so much of a bigger picture here than what we're missing with just growth, other than growth guidance and airway. We are going into rehabilitative, reconstructive recovery. We're going into medicine in an area that's completely ignored. And so, and I wanted to trademark because we are onto a lot of big things. When I say we, I mean, it's just me, but I tie my husband in there. I try to be as inclusive as possible. But so I wanted to trademark. I can't trademark About Face because it's used everywhere. There's so many businesses. Plus, it's for SEO. Um, and I wanted a brand that really connected to what it is that I do in Seattle, and that's how I connect allied medical dental providers into comprehensive, integrative, functional, orofacial functional medicine and recovery. So that's what we do. That's now Alamedin. We are in trademark. I'm also in trademark right now for orofacial recovery specialist. And so that's the Institute of Orofacial Recovery. My goal is to be able to advance the practice of dentists, dental hygienists, to do intraoral manual manipulation to help our patients in our chairs, to help dentists launch orofacial recovery departments. This is absolutely in the scope of practice of dentistry when it comes to working on the TMJ. At first, I was like, nope, you have to do all of these things and you have to go to school and you have to get endorsements and to be able to do these things, and nobody's allowed to do these things. And the more I researched, the more it humbled me in the sense that, no, actually, we don't. It is absolutely in our scope of practice as dental hygienists. There's no other provider and dentist. There's no other provider in the world that it's in the scope of practice to go inside of the mouth and work inside of the mouth. Dentistry is the only one that's taught to go intraorally inside of the mouth in the curriculum. No other practice does that. So, that to my knowledge, if there is, let me know. But to my knowledge, is only dentistry. Massage therapists can do it by endorsement. We have to have a 16-hour endorsement here in Washington State, and I think there's only 7 states across the country that can do intraoral massage. So, what I do in my practice, it's not massage therapy, it's not dental hygiene. I take a little bit of each and I combine them together into functional rehabilitative medicine. So, getting hygienists and dentists trained up in these modalities, not massage therapy, but manipulation to increase range of motion while patients are in the chair to get them in and out of their treatment more efficiently without pain, reducing trismus, the risks of trismus. Why can't hygienists do lymphatic drainage for the face? Why can't dentists have their own orofacial recovery departments? So medicine's not looking at this, and dentistry is a really good way to do that. So my goal is to be able to train more dentists and hygienists and what I do without them having to go back to school, as long as they are working within their scope of practice and licensure in the state that they're in, to increase quality of care, quality of life, and scope of practice. Okay. and that's the Institute of Orofacial Recovery. So we've got Alameda in downtown Seattle. I am working with the National Network of Healthcare Hygienists. I'm really trying to, I got the idea to launch a um, pilot study. Right now, everything that I do, I know it works. There are studies coming out of Japan that talk about dental hygienists and convalescent and palliative care. There are studies all over the place that talk about lymphedema therapy, lymphatic drainage for people who have undergone breast cancer or any other type of cancer, and how it's super effective at reducing scar tissue and long-term edema, long-term lymphedema problems. And so, why aren't we doing lymphedema therapy, lymphatic drainage for the face immediately post-surgical? Why don't we do that? And the hygienist is in the perfect position to be able to go in home under the supervision of a dentist, or go into palliative care centers, or um, go into hospitals as a myofunctional therapist, even a private practice hygienist in Washington State. If you're a myofunctional therapist, you can, as long as you have permission from a dentist, still as an independent contractor, expand your scope of practice of your myofunctional therapy by going into palliative care centers, by going into convalescent care centers, going into these hospitals, doing your orofacial myofunctional therapy, which is your rehab. Physical therapists, as soon as somebody has a knee replacement, that person, they need to be seen immediately. The physical therapists are like, no, I want to see you right away. We need to get on this so we can get you moving again, get the swelling down, get everything that we need to get, so we can get you moving again. It's no difference with the face. It's no difference with the myofunctional therapy and connecting this. So why can't the dental hygienist, who's an orofacial myofunctional therapist, go into convalescent centers and do the lymphatic drainage for the face and for the tongue, and go intraorally under the supervision of a dentist, but you're still independently contracted. So that's how we can get away with it in Washington State. Um, Plus, you can do, the advancements of laser therapy, photobiomodulation. Studies have proven that photobiomodulation, red light therapy for the face, which is gray area and scope of practice of dentists, dental hygienists, dentistry. It's been proven that it helps fight oral mucositis for people who are undergoing chemotherapy. For people who are, so it's optimal function. It's saving the teeth. It's protecting people. If anything, we're a coach. We want to coach these people through their process. If you haven't, what I do, because I'm really branching into oncology, and I think that's I'll amend, we're going to have a speech and language pathologist. We're going to have dietitians. We're going to, in 2025, when we move out of Seattle, we're going to have other myofunctional therapists who are hygienists. We're going to have massage therapists who I want to train in orofacial recovery and myofunctional therapy. Myofunctional therapy is a gray area. It's not really in anybody's scope of practice. Anybody can pick it up, as long as you have a really good understanding of the kinesiology of the face and the orofacial complex of the tongue. Massage therapists, physical therapists, any body workers in an amazing position to help these people, along with your dental hygienist, to help with the teeth and oral mucositis and soft tissue management, along with your dietitian for food intake if they have a port. Along with your speech and language pathologist, if somebody had part of their tongue removed, the massage therapist can go in and release and soften up that scar tissue underneath the tongue to get the tongue moving again. We can prevent scar tissue by immediately doing lymphatic drainage and lymphedema therapy. It's been proven over and over and over again that doing these therapies reduces scar tissue, gets the fluid going, gets the movement going. The tongue is so important. I work with people who have a part of their tongue removed, and they don't have to use a spoon at the roof of their mouth anymore. They can actually function. And then you're helping your speech and language pathologist, because these patients, they can't swallow because their tongue is so tight, right? I mean, I'm not going to send them in to release that scar tissue. There's still a lot of controversy around that, but at least give them some type of increase of quality of life. So, um, so that being said, that's what Alamedin is. We are going to connect a variety of different providers. I've got my oncology and massage therapy. I now have my oncology and dental hygiene through the National Network of Healthcare Hygienists. I am going back to school because I'm a forever learner anyway, next year to get my master esthetician license so I can go into oncology aesthetics. So I have a better understanding of the skin of people who are going through chemo and radiation and scar tissue and things like that, and hire on a permanent makeup esthetician for facial disfiguration. And it's not just oral cancer. Oncology is a big, big, big part of my practice right now. It's 90% TMJ. Um, and I do offer just myofunctional therapy on a case by case basis, but the majority of my practice, I have comprehensive care plans, people who are coming into me for TMJ. I love the complex cases. It keeps me busy. But we're going to have an oncology department, and we're going to have a group of allied healthcare specialists that just focus in on oncology, and teams that go into homes and palliative care centers to help these patients. And like I was saying before, if you haven't already, go onto the head and neck cancer groups. I am in these groups on Facebook, and I just sit and I just read. And I read what these patients are going through, and I read these questions that they have, and the majority of them feel dropped off. They feel ignored. They're not listened to. And as allied healthcare providers, we're in a perfect position to at least give them some guidance. We know we can't diagnose, we can't, provide anything more than that, but we can at least, coach them and guide them through these life-changing things. Even when it comes to facial reconstructive surgeries, myofunctional therapy, exercise therapy for the tongue has been proven that, to get the jaws back into alignment. So that's my rant about that. So the goal of the Institute of Orofacial Recovery is to train more hygienists and massage therapists and dentists to expand the scope of dentistry into orofacial rehabilitative care, just focusing on the orofacial complex, training up hygienists so they don't have to go back to massage therapy school, just in manual manipulation techniques. It's not massage therapy, but we can go intraoral. Um, and then of course we've got the unconventional hygienist, which I'm going to be talking about these things, hopefully some research studies, case studies, and things like that. So just getting information out there that this is a huge missing piece in healthcare, and this is what I'm trying to do with Alamedin, with the Institute of Orofacial Recovery, at least do a Q&A, because I do work with very complex cases where people have the discs popping out when they're opening. I have a 22-year-old right now who she had fat grafts placed in both of her joints. She's 22, and nobody looked at her tongue and how she can't even move it. So it's a very frustrating place to be, and I have to navigate that very, very, very carefully. But at least opening up the eyes and educating, because we know what we know, and we don't know what we don't know. And opening up these avenues, this education for the providers, to learn about, what does a restricted frenulum look like, or tongue tie. And I don't like to say the word tongue tie. I like to say you're restricted. There's not optimal range of motion. We need optimal range of motion. If you can't take your tongue to the back of your teeth and clean the back of your teeth, if you can't get your tongue all the way in between your teeth and your cheek, the top of that, then you don't have optimal range of motion of your tongue. So that's what I do, is I increase optimal range of motion of the tongue. I'm also testing the cervical spine. I'm also testing the TMJ, because they all work collectively together. So anyway, that is the introduction. Thank you for tuning in. I'm going to answer some of your questions now. Looks like, let me go back up. Okay. Um, let's see here. I am going through yes recovery. Kyla. Kayla. What is the best way to contact me for guidance? Why? Um, well, you have an independent practice in Maine. So, So you could just email me or you could just message me here on Facebook. I try to respond as efficiently as possible. Through the Institute of Oral Recovery, I am launching one-on-one coaching calls for anybody who has really complex cases and they're having a really hard time breaking through these cases and how I can help and who to refer. Then I also do group coaching calls to bring up your complex cases and we can work collaboratively. It's kind of like a study group. We do breakout rooms and then I go into the breakout rooms individually and help, you know, once the providers the myofunctional therapists, and hopefully I'll get some other massage therapists, body workers, or physical therapists on board to come in and help collaborate. It's all about collaboration. Collaborate and helping each other with these really complex cases. So you can contact me here on Facebook. You can email me at office@alamedin.com. You can, yeah, and I'll try my best to respond. Um, Let me see here. Tammy says, I thought we could do I thought we could do for trained by massage therapists. Maybe you could be the one to teachers and have CE course. Yes. So I'm working on, I'm connecting with CE providers. And we're trying to figure out the logistics of providing CE for dental hygienists and with training and things like that. So there's a lot of with dental CE, it's complex. I think that hopefully in the next month or two, we'll have that ironed out. And by the end of the year, we'll start providing CE for just these manipulation techniques. And that was from Tammy. Hopefully that answered your question. And then it says, how can we work with our state or what have you to get insurance coverage for these services? So, if you are a dental hygienist, and see, it's a gray area. If you are a dental hygienist, you're not practicing. If you're a myofunctional therapist, let's rewind. If you are a myofunctional therapist, dental hygienist, you're already billing massage therapy codes. 97110, 97112. You can't bill 97140. That is specifically massage therapy, lymphedema therapy. But as long as you're under the scope of practice of a dentist and it specifically states for TMJ. Now, what is all involved in TMJ? That's the question. The tongue is a part of TMJ. The muscles of the face are a part of the TMJ because they're all connected to the TMJ. And honestly, the muscles of the cervical spine are connected to the TMJ. So now I don't recommend going ahead and manipulating tissue in the cervical spine. Absolutely not. Definitely refer for that. But when it comes to the muscles of the orofacial complex, it's already tied into the insurance. If you're asking for insurance companies coverage for like liability insurance, it's already in our scope of practice to go into oral we do palpation. We do palpation of the lymph nodes. We do palpation of the muscles. TMJ's in our scope of practice because it affects the teeth. The muscles of the face affect the teeth. The muscles of the cervical spine affect the teeth. So, as far as insurance coverage, to be honest, having other insurance companies cover this, it's all under medical, and it barely covers what I do. And I'm a massage therapist. Because they don't. My daughter, for example, right now, she's 15. She's getting ready to go into an orthotic. We're seeing a TMJ specialist. He's one of the best of the best of the best. Chris Simmons, he is the diplomat of the American Academy of Craniofacial Pain. He's a TMJ specialist. This is what he does. He's been doing it for 40 years, and insurance isn't covering any of it. So they might cover the orthotic, but unfortunately with TMJ, even the TMJ Disorder Center that refers to me a lot, they are fee for service because insurance doesn't cover TMJ. So if that was your question and whether dental insurances or medical insurances are going to pick it up, it doesn't cover it anyway. Dr. Simmons bills the same codes that I do in my practice. I am fee for service. So it's one of those things that in a dental practice, if we are going to start supplying this in dental practices, raise your fee a little bit higher to help cover that cost. So yes, so she says no for patient services. Most people who are going through major medical procedures are definitely limited to funds and pay out of pocket. Yes. So it's because it's the face, unfortunately, it's considered it's cosmetic. And so it could just fall under cosmetic. But the chances of getting it covered are very, very, very slim in general. So in order to help support your practice, especially your practice, what I do in my practice is that I raise my fees a little bit higher if for any given reason to cover services that aren't necessarily covered. When I go to esthetician school and get my oncology aesthetic license, what I'm going to do is I'm going to just raise my massage therapy fees to help cover that. So, because you can't bill for it. So it's all a game on how and putting the pieces together and seeing what works and what doesn't work. So that's how that works. So it's all fee for service, unfortunately. Does that answer your question? Did I get all the questions answered? I hope so. Let me go back through here. Thanks, Dave. I'm a shy person too. Owning a business has definitely broken me out of my shell for sure because it's definitely broken out of my shell. Let's see here. Thank you. Yes, thank you. Good. Good. I'm glad I answered your question. Yeah, reach out to me. We can do coaching calls. We can do group crash courses, brainstorming with me and what I do with TMJ. Like I said, 90% of my practice is TMJ right now, but really trying to train these. If you have a massage therapist that does intraoral therapy, I did launch an oral pathology a crash course in oral pathology for massage therapists who are doing intraoral. We're not trained in massage therapy school about the teeth, the numbers of the teeth, oral pathology, where I'm working on that with a really amazing colleague of mine, um, who is here today with with me. She Carol Taylor. I'm gonna shout out Carol Taylor. She's out here at the Arlington School of Massage. She does an intraoral course, and I go in and talk about myofunctional therapy. And I have a bunch of cards for massage therapists that really want to work with you, myofunctional therapists, hygienists, and with body work, with the rest of the body, with craniosacral therapy, with somatic emotional release, with the things that we can't do. So, and then there's a massage therapist esthetician. So she does a little bit of both that we're looking at networking with. But yes, working with Carol, she's got her own intraoral massage class, but doing advancements in intraoral oral pathology, knowing what to look for, increasing oral cancer screenings. We do screen for skin cancers and things like that. As a massage therapist, it's our job to look, screen, and then refer to the doctor. And then we're just not doing it for the intraoral complex. So to get more eyes on these things when it comes to oral cancers and leukoplakia and lichen planus and periodontal disease and things like that. So anyway, thank you for coming and listening. I will have this pre-recorded, and we're gonna get up on YouTube, and we are going to. I'm gonna try and get it out to go out and Budsprout and get it podcast launch. But thank you for being here. Thank you for being supportive. Thank you for helping me work through the kinks. And hopefully next week we'll be able to launch. We'll take a deeper dive into some of these other things, into case studies. I haven't quite gotten it down yet, but hopefully I'll have it fine-tuned by the end of the day, and so I'll have another announcement. And then we'll try to keep these to about 45 minutes, if not a little bit less. And then I definitely want it to be a little bit more interactive. I would love to have people on in the podcast. If you want to be interviewed, let me know. If and what Talk about what makes you unconventional. Have a wonderful Saturday, everybody.